dedicated wildlife officers to save life of poor elephant who had fallen victim into horrific trap gun and sustained a critical injury in the left front leg. The elephant was living in a deep forest. It was the forest range officers who first noticed this suffering elephant during their regular patrols. They saw that the elephant was limping and its front leg is swollen and injured. Saddened by the sight of this elephant, they informed the nearest center of Department of Wildlife Conservation regarding the distressed elephant. As soon as they got the message, a team led by wildlife officers, Civil Defense Force officers, and veterinary officers were sent to the location along with several villagers. The officers prepared the anesthetics in advance. A calculated dose of sedative drug is loaded into the blowpipe of the tranquilizer gun. Armed with necessary medicines and equipment, they entered the dense forest. At the time they reached the location, the elephant was found in a critical condition due to the injuries sustained on its front leg. The elephant was lying near a muddy pit. The elephant was used to soak its leg in the mud to soothe the excruciating pain in the leg. The elephant became agitated with the sense of the humans. He stood up from its lying position. The officers fired the tranquilizer gun to sedate the elephant. The elephant gets a little nervous when he felt the sedative prick on him suddenly. So, he moves into the forest, limping his way. In the meantime, the drug gets active and sedates the elephant within 5 to 10 minutes, making him fall down in the forest. Now, we can see a closer shot of the horrendous injury on the leg. The vet carefully examined the wound and determined that it must have been caused by a horrific trap gun. The metal parts and ammunition in the trap gun may have inflicted this brutal injury on the elephant. The wound has been infected secondarily, forming an abscess. They further secured the elephant with ropes for added safety. If the elephant were to revive before completing the treatment process, it could be dangerous. That's why they took this precaution. The officials hurry themselves to treat the elephant. The elephant is experiencing excruciating pain and has been weakened, lacking the energy to move. An injury to its leg has impaired its ability to walk long distances in search of food. Therefore, the team decided to prioritize the elephant's well-being and alleviate its pain. They began by administering necessary injectables, long-acting antibiotics, painkillers, anti-inflammatory medicines, multivitamins, and ivermectin were administered intramuscularly to aid in the elephant's recovery. Antibiotics kill or inhibit the growth of harmful bacteria. By eliminating bacteria in and around the wound, antibiotics prevent the infection from worsening, allowing the body's natural healing mechanisms to work effectively. Painkillers are given to alleviate pain and discomfort. Pain management is crucial in the treatment of injuries, as it can help the animal remain calm, reduce stress, and promote healing. Trap guns are set in agricultural lands to protect crops and livestock from wild animals like elephants, boars, and deer. Some individuals use these devices for hunting wild boars and deer for bushmeat. However, larger animals like elephants can also be harmed. Although not always lethal, trap guns can severely disable these animals if they don't receive prompt treatment. These devices consist of shotguns rigged to tripwires, discharging when triggered by an animal, posing a significant danger to wildlife. The veterinarians have chosen not to remove particles from an elephant's gunshot wound due to complexities and lack of facilities. Handling such a large wild animal in this location is difficult, and conducting surgery requires extensive resources unavailable there. Providing post-surgery care and limiting the elephant's movements are also not feasible. Keeping the elephant sedated for extended periods poses a significant risk, so the veterinarian's plan focuses on managing the infection and wounds to enable the animal to eventually survive in the wild. After administering the necessary injectables, the focus shifts to treating the painful wound. First, the wound is carefully cleaned with disinfectant to prevent infections. Then, Negacint powder is applied to the wound to aid in the healing process and promote recovery. Negacint powder contains active ingredients with antibacterial and antifungal properties, forming a protective barrier over wounds to prevent contamination and reduce infection risk. It absorbs excess moisture, maintaining optimal healing conditions by preventing bacterial growth. After applying Negacint powder, a povidone iodine solution is used on elephant wounds. This antiseptic solution kills bacteria, viruses, and fungi, creating a clean environment that supports natural healing and minimizes infection risk for the elephants. The officials completed all the initial treatments, and without delay, they swiftly administered the revival drug into the elephant's ear vein. Keeping the elephant unconscious for an extended period is not advisable, so prompt action was taken to awaken the animal. The elephant showed signs of regaining the consciousness. The team plans to return to provide further treatment after 5 days. The elephant will continue to receive treatment until the wound is completely healed. During this time, a forest range officer has been assigned the responsibility of monitoring the elephant's condition. Now there is no life risk to this elephant, as it was fortunate to receive timely treatment. The veterinarian assured that the infection can be completely healed, providing hope for the elephant's recovery.